Welcome to our Antenatal Education Class. The following short videos and slides will help answer some of the questions you may have about the changes that happen to your body in pregnancy, the labour stages and pain relief, and what happens once the baby is born. This information will assist you to make birth choices in your birth plan. This generally happens around 34 to 36 weeks. Please speak to your community midwife for further details. The following slides will guide you through why staying active during your labour is important and show you useful coping strategies to use whilst at home or hospital. Normal labour starts between 37 and 42 weeks. There are different stages in your labour. Early or latent first stage. You may experience contractions that do not settle into a pattern. These may be painful and you could start several days before labour begins. You may have a show or your mortars may break. Your cervix will soften, thin and start to dilate. If you need reassurance, please contact your community midwife, midwifery base, pregnancy assessment or birth centre. Once labour is fully established, it is, for most women, over within 12 to 24 hours. Active first stage. The contractions will now be regular, equally spaced out, and of similar or increased strength to the contraction before. The cervix or neck of the womb softens and opens until it is wide enough, 10 centimetres, for your baby to move down into your vagina, the birth canal. Second stage. This is the pushing part of your labour. Your baby will move down your vagina and out into the world. This may last up to 2 hours for a first baby. Third stage. The placenta and membranes peel away from the uterus or womb and come out of your vagina. We use several aromatherapy oils at Chesterfield, and your community midwife may have already introduced you to some. Only use what your midwife has given you, as these oils will have the desired therapeutic effect. You may continue to use these at home, either in the bath, as a massage, or inhalation, depending on what blends she has prepared for you. Staying calm and doing your deep breathing is really important during your contractions, as you need to provide the baby and the uterus with oxygen. Build up your endorphins, which are natural painkillers, and oxytocin, the hormone that will get through the labour. Take each contraction as it comes and forget about the time. Keeping calm and focused will help you reduce stress levels and the negative effects that adrenaline can have on the labour. Follow your instincts and move around. Change positions or have a nap in between. Do what feels right. You cannot rush this process even if you try. Have good birth support from your partner, relative, or even a friend. They will help keep you relaxed, hydrated, and nourished. You will need calories for your labour to progress. If there is a clinical reason why you should not eat, your midwife will inform you of this. Remain positive. Each contraction is one closer to holding your baby. Soft lighting, music, and comfortable clothing will help you keep calm and relaxed. Familiar things and surroundings also help keep adrenaline low and stimulate the release of endorphins and oxytocin. We have different aids to help you keep in the best positions for your labour to progress. Keep your visitors to a minimum to help you remain focused. Your birthing support will give you encouragement, and keep you focused on how well you are doing. If you could be doing something differently, they'll make suggestions too. They may keep you hydrated and nourished, so having a goodie bag with different drinks, snacks, or even sweets is often helpful. They may offer you massage, comfort, and support, as well as keeping you positive in your journey to parenthood. Your midwife will encourage them to work as a team. Whilst you remain active and mobile, gravity will assist the contractions, so you will have two powerful forces helping birth your baby. The pelvic joints will remain free to move and expand, giving the baby as much room as there is available, encouraging an easier journey through the pelvis. The placental flow and oxygen to the baby improves as there are no restrictions from the heavy uterus. Your labour may be shorter and consequently the need for pain relief will be reduced. It gives you control and confidence in your body's ability to birth a baby. In the next 3 slides, we are going to explore how the 3 P's work together: the passenger, your baby, positions, and your pelvis. Ideally, your baby is well flexed with his or her chin tucked on its chest, down in the pelvis, and in anterior position with his or her back at the front of your tummy. The bones in the skull overlap and make the diameter of the head smaller. If your baby is deflexed, the chin is not tucked on its chest, or posterior, its back is on your back, he or she will need time to rotate, and opting for an upright, forward position will help aid this. Ask your midwife for further information. The following slides show you different positions you may adopt to make birthing a little easier. Try one or try them all. Your body will tell you what feels right at the time. You can increase the capacity of your pelvis by 28% just by changing to different positions. The shape of the pelvis directs the baby to the outlet, so the more room your baby has to maneuver into the world, the easier the journey will be. There are different hormones that allow your pelvis to expand, and you may have noticed your pelvis becoming uncomfortable towards the end of your pregnancy as this process takes hold. Remember to keep your pelvis open to maximize what room there is available for your baby to be born. Essential oils can be used to reduce stress and relieve pain. There are several oils available and they can be used in different ways. For example, inhaled, in a bath, or as a massage. Please ask your community midwife for further information as these oils can be used from 37 weeks onwards. Massage is brilliant for reducing tension and comforting you. It can be done anywhere: your shoulders, your back, your tummy, your feet, or even your hands. A tennis ball provides even pressure, particularly on the shoulders, helping reduce tension and keeping you relaxed and focused. TENS stands for transcutaneous electrical nerve stimulation, and it works by sending electrical pulses via 4 pads placed on your back. It builds up high levels of endorphins, which are pain-killing chemicals. You will need to hire it through your local pharmacy or via the internet, but remember to ask for one that is suitable for labour, i.e. 4 pads. TENS is very effective in the early stages of labour. It cannot be used in water, but you may combine it with other forms of pain relief. For further information, please ask your community midwife. There are 4 pools at Chesterfield Birth Centre. You may find the water soothing during your labour, and relaxing in deep, warm water both supports your weight and alleviates the pain. A warm shower can help ease lower back pain, particularly early in your labour. If you are interested in the pool, please ask your community midwife to discuss suitability with you. Entonox is commonly known as gas and air or laughing gas. You breathe it in through a mouthpiece. It will encourage you to remain focused on your breathing and taking deep breaths in. It is easy to use and you remain in control, but it is important to only breathe it in with a contraction. It may make you feel dizzy, giggly, and high. Some people feel sick, but labour in itself can make you feel this way, regardless of the form of pain relief you choose. The effects are short-lasting, so when you stop breathing it in, it stops within 30 to 40 seconds. It does not relieve the pain entirely, but you may use it with other forms of pain relief, for example, in the pool. Pethidine is given into your thigh by injection. It can make you feel sleepy, relaxed, lightheaded, or sick. This may make you want to lie down. Remember that labour in itself may make you feel sick. It does not relieve the pain entirely, but it will make it easier to manage. This form of pain relief will cross through the placenta and may make the baby a little sleepy to feed effectively. Epidural is carried out by an anaesthetist. An injection of local anaesthetic and painkiller is given into the epidural space in your back through a fine tube called a catheter. This is then topped up as you feel you need it. You will also have a drip of fluid running. This is to keep you hydrated and to counteract any side effects from the epidural. Epidural can drop your blood pressure, and this form of pain relief may be recommended to you if yours has been high during your pregnancy. Your baby's heartbeat will be monitored continuously, as any sudden drop in blood pressure may also drop the baby's heartbeat. The midwife looking after you will deal with this if it happens. The aim of an epidural is to block the pain from the contractions while still being able to move your legs. When your baby is ready to be born, you will be aware of your contractions to help you with pushing. You can have an epidural once your labour is established. If your legs get heavy, you may be confined to the bed. This may slow your labour down. It also increases your chances of needing assistance for the birth, for example, ventouse or forceps. Epidural does not have any effect on the baby once he or she is born.